is Carla Atherton, Director of the Healthy Family Formula and host and producer of the Children's Health Summit 4. In response to the rapid rise in conditions such as autism, cancer, ADHD, GI distress, anxiety, depression, asthma, skin conditions, learning disabilities, and autoimmunity, the topic of this year's summit is preventing and reversing childhood chronic illness. And today I'm very excited to be interviewing this session speaker, Dr. Terri Hirning. Terri is a doctor of natural medicine, focusing on holistic wellness and detoxification in Flagstaff, Arizona. She works with clients all over the world to educate them on ways to support optimal health, wellness, and detox practices. Terri integrates many modalities in her work. Her background of having worked for the Great Plains Laboratory gives her a strong basis and understanding of their laboratory testing. She also currently works for New Beginnings Nutritionals and is highly trained in the implementation of supplement programs in conjunction with a healthy diet to support optimal wellness. And that to the extensive knowledge of nutrient-dense and healing foods, she puts together a complete program that is actually implementable for individuals and families. Her son, Matthew, is the inspiration for her work with others. He's considered recovered from autism, so it is through their journey that she really has an understanding of the intricate issues that can be involved in this disorder. Welcome, Terri.
Thank you so much. It is a pleasure to be here with you.
It's just fantastic to be here. We were just chit-chatting before we started recording about some ways that we completely intersect. So I'm really, really excited to be talking to Dr. Hirning about all of these wonderful modalities, especially one in particular that she uses in her clinic and teaches people to use and educates and spreads the word about in regards to detoxification. So welcome.
Thank you.
All right. So first, I mentioned the word detoxification. So first, I guess we would talk about toxicity. So how does toxicity contribute or exacerbate chronic illness?
It is, in my personal and professional experience, one of those root cause and or one of those big pieces that exacerbate any underlying chronic illness. So when I speak about my son's autism treatment and recovery, a large piece for us was detoxification. And then when I opened a practice and began working with other clients around the world, no matter what we were trying to focus on, when we address toxicity, all of the other areas or factors improve. And so when we're talking about even just the basics of cellular communication, when you have toxic burden, which unfortunately our children are facing at a very alarming rate. When you or I were being born, our parents were not exposed to as many chemicals or toxins as our babies are being exposed to today. You know, some reports, even a decade ago, were saying that in cord blood, we were finding over 200 chemicals. And that was just of the chemicals we can identify and test for. Mm-hmm. So that is absolutely astounding. So when we talk about genetic predisposition, when we talk about epigenetic changes, we understand that these chemicals and these toxins are having our genes influenced. Which genes are turned on, which genes are turned off. And then if we talk about genetic susceptibility for impairing detox, right? We know some of our kiddos with these chronic illnesses have impaired detoxification. My son is one. And when you have a child who not only are we overburdening their little systems with toxicity, but now they have a body that is not efficient at detoxification. Where do you go from there, right? And that was really where we were 12, 13 years ago in trying to address, okay, so we can do the lab testing, we can figure out what chemicals are an issue for our child, but how do we get these chemicals out of their little bodies? And I've seen this not only with my own child, but with other children and adults. When you reduce the overall toxic burden, you see that addressed in the lab values for sure. But what's also even more exciting is we see it in the way our children are responding to the world around them. Mm-hmm. We see it in the way their skin changes. We see it in their metabolism. We see it in their immune system. We see it in language, cognition, fine motor skills, gross motor skills. And those are the areas where it's really exciting to see the changes when you implement an effective, safe, non-invasive detoxification strategy. So, you know, my passion is detox, because if we're trying to push in a bunch of supplements or make dietary changes, all of which can be very important in an overall wellness protocol, but if you're not opening up and supporting those detox pathways, then the system is not functioning very well. You know, chemicals bind to cellular receptor sites, and it inhibits the exchange of nutrients. It inhibits the cellular detoxification. So if we can stimulate the body, give the body what it needs to liberate those cell receptor sites, you're going to have a child or an adult who's utilizing minerals and vitamins in a way that they weren't able to do. And of course, that's going to have brain ramifications, it's going to have body ramifications, and it just overall makes the entire system work better. And so when you're talking detox, anybody who's alive on planet Earth right now, you know, we can certainly, and I educate a lot on how do we avoid these chemicals, right? Because we have the power to do that. Parents, you have the power to revamp your kitchens, revamp your diets, reduce some of these chemical exposures that have become commonplace. But at the end of the day, even people who have made those changes are still exposed through our water supply and through the air and through our foods if we're not eating, you know, 100% all of the food we're growing ourselves, which is not feasible for most people. So we always have to address detoxification, which is why I'm so passionate about it.
Mm-hmm. Okay, that's amazing. So, so I guess we could talk about some ways. So I had like a bunch of questions and you just kept answering them. I was going to ask you, what is the importance of detox? So what is detox? What is toxicity? Okay, so you explained all that. You know, what is the importance of detox? Well, it's what? Like to make sure that the body will actually absorb minerals and use the minerals and the firing's all proper. Like, can you give us a little bit more about why it's important to actually get rid of these chemicals out of the body and what can happen once you do?
Yes, and one of my big passions is glyphosate. It is a prevalent chemical that's in our water supply, it's in our food supply, even those who eat primarily organic. And I can talk about the research that we did using the IonCleanse by AMD detox modality. But what we're facing is global exposure to these chemicals and these toxins. So why is glyphosate important or something to know about? One, it's pretty insidious. So even if you're eating an organic diet, even if you don't eat wheat, because, you know, even the wheat is not a GMO crop. So when we talk about GMOs, we talk about genetically modified organisms. And these are foods that have been genetically adapted to withstand the spraying of glyphosate-based herbicides, Roundup being one of the most common and well-known forms. We see Roundup sprayed on our playgrounds, on our local city grounds. Some of us may have used Roundup or use Roundup still. And this chemical is also prevalent in our food supply. So when they are doing the mass production of foods, they can liberally spray this herbicide, and the plant can survive. So let's just take a minute to think about that, right? Mm-hmm. So now we've genetically made the plant that should have been dead when it's sprayed by this broad spectrum herbicide, and now we've made food that can withstand that. That in and of itself is problematic. So reducing your consumption of GMOs is really important. There are a lot of great organizations out there that give you a lot of resources if you want to know what foods are genetically modified and how do I avoid those. But even if we're not looking at genetically modified foods, which wheat at the filming of this summit is not technically genetically modified, but they will spray glyphosate as a drying agent. So now they can harvest the wheat or the grain, because it's not just wheat. They can harvest the grains faster. They don't have to let nature take its course and let it dry on its own, because, you know, profits over people, honestly, and they can get it to market faster. So even our non-gluten grains can be sprayed with glyphosate. I show a visual in 2018, and Resco Labs did an analysis, and the number of foods, including big brands like Cheerios, Quaker Oats, the amount of glyphosate that is found in these foods that are seen on breakfast tables all around our country, fed to our children multiple times a day, possibly, when you're talking about a cereal for breakfast, a granola bar for snack. The levels are extreme. And really, the EPA even says, the safe level, I don't believe there is a safe level. So when we talk about a chemical such as glyphosate, right, it has been linked into kidney disease. We've seen this around the world when they've come into countries like Sri Lanka, El Salvador. The workers that were exposed to this chemical saw kidney disease at an incredible rate without the other factors that usually go into seeing kidney disease. Liver toxicity, the microbiome wipeout, right? Like when we are ingesting glyphosate, it is decimating our microbiome, which of course is that hub of our immune system. It's the hub of autoimmune triggers and inflammatory triggers. And so this insidious chemical is really a prevalent concern. And so when we talk about these chemicals, there are all these downstream effects. And the reason why glyphosate has been called, totally safe for human consumption is because it works on specific enzymes that humans don't have. But guess what? Our gut bugs have those. And so it's all involved in this tryptophan metabolism, tyrosine metabolism, and those two amino acids are tied very closely with neurotransmitter functioning and mood. When we look at our children today, I am very concerned at the skyrocketing rates of anxiety and depression and mental illness in our childhood population. This is not an issue that is reserved for adults. We're seeing kiddos, and how much of that is tied to this microbiome component that's involved with some of these chemicals that are inhibiting our good gut bugs from doing what we need them to do. So in terms of, I'm just picking on glyphosate because, again, when we looked at the excretion rates of the people in our studies, we did 19 participants, 9 of which were in the control group, 10 of which were in a cleanse group. And what we did was 3 days a week cleansing for 4 weeks. So you're talking 12 cleanses at the end of the day. And we saw a 34% increase in excretion. So the people who partook in the IonCleanse by AMD technology, they had lower glyphosate levels by 34% than the control group at the end of the 30-day period. And that was pretty huge. And we've looked at this technology in regards to mold excretion, looking at ochratoxin A levels, and so we continue to keep seeing what can we help the body excrete. There's a lot of research out there on sauna therapy as well. So when we talk about detoxification, as a parent, my first and foremost concern is safety. Right? When we are looking at detox, there are a lot of detox mechanisms out there. I like the avoidance piece. If we can just stop the flow coming in, then we can, or at least slow it down. I don't think we can completely stop it. No. Then we have less to worry about, right? We have less that we're trying to get our child's body to excrete. And if we have a child who has methylation issues, or we have a child who has a specific genetic issue to where they don't detox in a effective manner, then we're really looking at how can we boost our child's ability to detoxify. So in terms of some of these chemicals, I think we're at really the tip of the iceberg. I mean, the more we understand about things like BPA, phthalates, glyphosate, all of these endocrine disruptors, they have big implications in how our children move through puberty, how they process and produce their own hormones. I don't think, we're even at the point where we've seen the full effects of what all of these chemicals have done in utero, and also now that our children have been born into this world, and where that's going to go in terms of this chemical overload.
Yeah, exactly. We just don't know what's going on. So really, let's just get it out, because we already know that there's a lot already that, is implicated in toxicity, right? So we're, all of those conditions I rattled off at the beginning in this intro, have some sort of like causal relationship with toxicity. And so you were talking about studies, and we're going to get into talking about what the IonCleanse is and what it actually does to actually get rid of toxins. But just before that, you were talking about, you work for Great Plains Laboratory. And you said there was a study as well. So, I mean, and this study is measuring, the excretion. So when you said excretion, does that mean that, you're noticing the stuff coming out, or are you know that the levels in the tissues are actually gone down?
So, and that's a really good clarification, because yes, I used to work for Great Plains. I am very familiar with Dr. Shah, who owns the lab, and just his level of integrity and attention to detail, and why he's created the lab tests that he has created is really to answer this call. And he is affected in his own family by autism. And really, it's, how many of us that have gone on to become practitioners and work with others have done so because we really have skin in the game. We were working to heal our own family members. And so when I talk about glyphosate, and when we look at tests like the GPL tox, for example, that's where it gets a little tricky, because some of these chemicals are fat soluble, meaning they're stored in the fat. And so you might actually see a spike, and that could indicate greater mobilization from the fat tissues and excretion. Glyphosate is a direct marker, meaning what your level is what your level is. So if it's higher and then the next time you test it's lower, that's good. It means you have less body burden of that chemical. And that's really what we were measuring with the glyphosate marker from Great Plains Laboratory.
Okay.
And it is a water-soluble toxin, so you would expect it to have a fairly short lifespan. Mold mycotoxins have a much longer detoxification span. You could be detoxing mold anywhere between 2 months and 12 months, and that's using binders and liposomal glutathione and sauna therapy. So it is important to understand whether it's a water-soluble, fat-soluble toxin, how the body normally excretes it. You would normally see fluctuations. So in our control group, we did see a slight reduction. The issue is we saw a much greater reduction. So the average difference was 34% more, reduction in levels in our cleanse group versus our control group. And so that begs the question. We are looking at replicating this study and getting it IRB approved and being able to publish. I have since done other case studies, and if I'm going to do a case study and the person's up for it, I'll test other levels as well. And so I did a mold case study, and I also threw in glyphosate just because, and the person did not have really elevated glyphosate levels, but they had, somewhat elevated glyphosate levels. And over that same time period, 30 days, again, it tracked at a 29% reduction. So 29% in a one-person case study versus 34% in the group trial, it tracks pretty nicely. So when I start seeing patterns of, okay, and we're able to replicate the science, that's when I really know something is here. And beyond that, when we talk about a technology like IonCleanse by AMD, and we can talk about what is the mechanism, what's happening, what is the body being exposed to, but even more than the lab values, which I think are extremely important, we also measure the anecdotal and symptomological changes. Are you sleeping better? Do you have less anxiety? Do you have less pain and inflammation? Those are the pieces where if we can jive two together, terrific. But we also know sometimes we're going to see some of those symptomatic changes before we get those lab markers to shift much. And it really depends on what tests you're doing. So it was a direct marker. So the level is what the level is. And so when we saw that reduction, we were pretty excited. And of course, this is a piece of the puzzle. It's not going to address the microbiome issue with glyphosate, but in today's world, I feel like we have to be looking at what are effective technologies, because it also has to be easy to do.
Yes.
It also has to be practical to do, right? If we're dealing with children, it is, you're not going to get your child to do an IV, therapy, IV Myers cocktails or things like that, IV glutathione. That's not practical. We've had a FAR IR sauna in our home for a decade now. And I'm going to tell you, when my son was 5 years old, it was like, pulling teeth to get him to sit in there, and it's hot and uncomfortable. I have since moved into near IR sauna, and that is much easier, but he's also 15. The IonCleanse, has been one of those modalities that my kids don't fight me on. And so I know they're getting really great support on their overall body. And it's not a battle for me, and I've had parents, come to me in my practice and say, my child's 2 years old. How are they going to sit in this Footbath? They do. And I know it's, skeptical at first, but I do believe that our children understand what is really helpful for them. Mm-hmm. And I've heard of, children who are nonverbal who will go and get the tub and pull it out and want their parents to do their cleansing. I have a client with a child who started seeing me just before he was 2, and he would cry when his session was over. And, it's that kind of stuff. He was relatively nonverbal, so he couldn't say he wanted to have more of a session, but he would cry every time it was time to stop. So it's that kind of thing where, it's great. And it is, as from a person who does it all the time, it's very relaxing. And it's part of that shift into parasympathetic, right? So when we talk about chronic illness, when we talk about autism, when we talk about inflammatory conditions, that sets our body up. When we talk about Wi-Fi, with 5G coming to all of the, areas, that sets us up for living in sympathetic dominance. And that is the state of the nervous system being in fight or flight. Mm-hmm. That's not where we do our detoxification. That can be very stressful for the body. And what I have seen is that the IonCleanse technology helps the body shift into parasympathetic. And we can talk about case studies on how I've seen this and what this would look like in some individuals if you'd like. But just shifting the body from being in fight or flight to being in rest and digest, if nothing else, stimulates the detoxification.
Yeah, for sure. Yeah, I mean, all of that. And so do you use, the IonCleanse Footbath in conjunction with other things for detoxification, or is it something that parents would pick just on its own? Like, how does that look?
I love pairing technologies. I love personally pairing IR sauna or near IR light therapy, liposomal glutathione. I like an approach where you've started with some lab testing, you see what's at the root cause of what's going on. We look at what is, a well-tested intervention for mold toxicity, for example, which is becoming more and more problematic. I see this in my practice a lot, and I see people who really feel the effects of mold at a higher rate than I think we've ever seen, or at least that I've heard of. And so you take something like a liposomal glutathione or a binder, right? Those have been well studied and very scientifically tested. Great. Let's bring some of those on. Let's bring in sauna therapy if the family can do that. Let's bring in IonCleanse. Let's bring in rebounding, dry brushing. I look at it as, what does the individual need to boost their detoxification? So if we can bring in some of these other modalities, I absolutely love it. And what I really focus on, so when I think about sauna therapy, so if you think about your body and toxicity as like a very crowded, Los Angeles freeway, right, at rush hour, you've got all of these toxins that are trying to get off of the freeway at their stop, right? Whether that's through sweat, whether that's through the stool, whether that's through the kidneys. And it's just gridlocked, and those cars are just not moving. That's our detox system nowadays, okay? So when you look at sauna therapy, or you look at other therapies that are really stimulating the body to detoxify, right? And you do get some of that release through the skin, but then some of that is also going into the normal metabolic pathways through the kidneys and through the bowel. And it kind of adds to the traffic jam. One of the things I love about IonCleanse technology is that it's like adding more exits.
Mhm.
because there is an excretory piece of what's in the tub, right? But that's only a piece of the puzzle. I've had even parents who took part in the original Thinking Moms Revolution study where my son was a participant. There was one mom who was only born with one kidney, and she was very symptomatic and had heat intolerance and exercise intolerance. And in her words, she said the IonCleanse functioned as a second kidney. So it really took the burden off her kidneys and allowed for some excretion. How much, we don't really know. And I don't often focus on what's in the water. I don't often focus on the color or the textures or whatever. I have always studied the urinary excretion in the individual, and that's really where my concern lies. But there is an aspect of excretion that does help unburden the body. So now you have a freeway where maybe they've opened up a few more lanes for you, or maybe they've added some new exits, and it allows the toxins to be excreted at a more efficient and effective rate. So no matter what else you're doing, this is a perfect partnership. And it's something that's, it's very calming, it's relaxing. You're sitting there with your feet in nice warm water. There's not much to it. And then you just sit back and relax.
Easy.
And what's nice is that it is easy. And they've tested it to show that it does not have EMF coming off of the unit.
Great.
Because when you're exposed to EMF, and I always recommend, families, when you're doing this, limit or reduce or eliminate, if you can, your child from using a device that is emitting EMF, because then you're closing up those detox pathways. When we're exposed to EMF, it really is shifting us into that sympathetic dominance. And we want a body to open up and be able to release as much as possible. If it comes down to the person not being able to get the intervention done unless their child has the iPad or the phone, then do it. Try and download things to where you can put it into airplane mode, things like that. But you can sit and read a book with your child. And we're talking sessions that, depending upon the age of the child, can range between 10 and 30 minutes. So it's not a long duration. And then the frequency really is based on what you're trying to achieve. If you have a child with a chronic illness, the standard protocol that we work off of is 3 days cleansing, 1 day off, 3 days cleansing, 1 day off. And really, then you watch your child, or you watch yourself. How am I feeling? Am I starting to feel a little bit irritable, or my sleep is off a little bit? Well, that might be a sign to back it off a little bit. But in terms of that Herx reaction, we see it in a much lower percentage of people than in other interventions that are out there. And that's appealing to me too, because when we're dealing with children, as a mom, I've done interventions that made my child Herx. And that is, we have enough mommy guilt as it is. We don't need additional mommy guilt over trying to do something that helps them, and it's actually, not comfortable for them, right? So, it is a very powerful modality.
Yes, for sure. I was actually I was going to ask you about the Herxing, because so I guess maybe we should, we'll come back to that, because I want you to explain, please, what the IonCleanse is actually doing. So it's a foot bath. We understand that. We can kind of envision our children doing this. It's easier, it's safe, it's like non-invasive. It's, it's not like a heavy duty chelation or anything like that can create a Herxing. It can, you said maybe, create some kind of Herxing with the children, and then you just back it off. But first, I think it'd be really important for parents to understand what the IonCleanse actually does, like that technology, and how it helps people, to your kids or adults, whoever, to detoxify.
Absolutely. And it's a really simple process, but I want to be clear. I'm specifically talking about the IonCleanse by AMD. It is an American-made product. There, you could go to Amazon, and I say the same thing about supplements. You can go to Amazon and you can get cheaper units, and there's a reason they're cheaper, okay? I'm just going to be honest. Other units do not use stainless steel parts for the plates. They use nickel. They are single polarity, or they do not have the patented dual polarity that IonCleanse by AMD has. And I'm going to tell you why that's important. So when you start a session with your child, what is being done is your child or yourself are being exposed to positive and negative ions. So when we talked about toxins, and we talked about toxins and chemicals binding to receptor sites, all of those toxins either have a positive or a negative charge. Some of the common chemicals that have positive charges are heavy metals. Some of the common things with a negative charge include ammonia. So if your child has high ammonia, if they're on a ketogenic diet, if they're on a high protein diet, you might have experienced your child have high ammonia. Some seizure disorders are linked to ammonia toxicity. Mycotoxins are negatively charged, so mold endotoxins, Lyme endotoxins, parasite endotoxins, and glyphosate they're all negatively charged. And that's where most units miss the boat, because most units only introduce a positive charge in the water. So when the feet are being exposed to a positive charge in the water, it's that old adage, opposites attract. So the negative charge is attracting the positively charged toxins. So if they have bound to a receptor site, when the body is exposed to those negative ions, those positively charged, maybe heavy, maybe aluminum, let's say, they feel that charge, they release from the cell receptor site, and they move into the body for clearance. So the machine is pre-programmed to alternate between generating those negative ions and then switching and generating the positive ions. And that's where it's really important, because if you have a cheaper system that is only exposing the body to the negative ions, you're missing a majority of the puzzle. I'm going to be honest. Are heavy metals problematic? Absolutely. But I am seeing at a much higher rate children and adults with co-infections, Lyme disease, kids with pandas, with strep, with ammonia toxicity. And so if we're just focusing on heavy metals, we're missing a larger piece, glyphosate excretion. Obviously glyphosate is an issue for all of us on planet Earth. And so the machine will change back and forth at pre-programmed intervals and give the body a really nice, complete detoxification experience. And really that's the basics of it. It's, really easy and simple. While the child or the adult's feet are in the water and the machine is on, it's a one-way valve. So there's only excretion. You're not reabsorbing anything unless you turned the machine off and sat with your feet in the water for a period of time. Then you would, be exposing yourself to reabsorption. But it's a super easy process. You want to work with a practitioner or get some guidance on duration and frequency, because of course every child is different. The standard protocol, like I mentioned before, is 3 days in a row, 1 day off. But that's not always appropriate. And there are definitely signs and symptoms that say maybe you need to back off. I always say, first off, this technology isn't pulling anything. It is liberating those chemicals from those cell receptor sites. So then what happens? The magnesium or the zinc or the calcium that is, floating around waiting to be bound and absorbed, they now can, right? So you could utilize more minerals as a result. You also utilize more minerals when you detoxify in general. So I do have some really sensitive clients that they require extra minerals when they are doing IonCleanse technology. I have others like myself, because when my son was going through the initial study, which was 120 days, and at that time, this was all new in the autism community. We were creating the protocol, right? And so we started out with every other day cleansing. And I don't know about you, but I always try these things on myself. Let's see how I feel doing it. I want to see what, I want to make sure it's safe. I want to see what my son might be feeling. So I did it right along with him. I did, the 60 cleanses, so that would be every other day. We did morph it into the 3 days on, 1 day off because of what we saw during the study. But on average, it was about 60 sessions. I never gave myself additional minerals. Now, granted, moms always, most of the time put ourselves last. So there is that little caveat. But I had none of the, signs of breaking nails or, I didn't feel mineral deficient. I do have clients. When we do sessions in the office, we always give a trace mineral supplement just to be on the safe side and to bolster the body. But really, in terms of contraindications, when we talk about who should not use this technology, people with pacemakers, people with medications that need to remain constant in the body, because what happens when you're really supporting and opening up the detox pathways, the body might metabolize and excrete medications, which it does see as a toxin, at a greater rate. So people who have organ transplants and need anti-rejection medication to remain stable. Parents of children with seizures have very successfully utilized this technology, but it's always best to work with a practitioner who is knowledgeable both in seizure disorders and IonCleanse by AMD technology to guide you in what to look for, maybe some extra precautions. But above that, really, what we mostly see, if we see some sort of Herx reaction, is irritability or maybe a little bit of sleep disturbance. I have a case study of a client whose little one was just 2 years old when he started seeing me. We did a 10-minute session. The child had vaccine reactions at some point in time and had not been able to sustain sleep since then. And one 10-minute session, mom emails me the next day and said, my child slept for 10 hours.
Oh, wow.
And 2 separate therapists had come into the house the next day to do their therapies with him. Both reported, he's like a different kid. What have you done? Now, do we see that with every individual with autism? No, but I hear those. I used it one time and I feel a difference stories and we saw a difference. When we were doing the study, I saw a difference in my son after the very first cleanse. And what I always tell the people working with me, if you don't want to come into the office and do it, you want to do it at home, or you want to cleanse your whole family, because who wouldn't benefit from this? Yeah. Buying their own unit is the way to go, right? Mm-hmm. And IonCleanse offers a 60-day money-back guarantee. Mm-hmm. There is no risk. I say worst case is you got 60 free days of cleansing, and you're gonna see something or not by 60 days. So if you bring it in and it's not working for you, send it back, because it's not there is nothing, and I know you know this, there is no one size fits all anything. Mm-hmm. So when people start talking about these miracle cures and things like that, we do have to be educated consumers. But in my experience, personally and professionally, this is one of those modalities that benefits a great majority of the people in my practice. Yeah. And I've been in a study group with 24 families. I watched the second study group that they did with the Thinking Moms, looking at the older kids. That was another 20-something families. When you start seeing the miraculous things that come out when we support safe, gentle, effective detoxification, it's hard to not be a believer, because I'm going to tell you, there were many conferences where I walked by and was like, yeah, right. Like, give me a break. That is such a gimmick. And it wasn't until we took part in the study and I really opened my mind to what is happening at the cellular level. Because there is a tendency, like, I'm a skeptic for everything. I'm going to tell you, and being around, my son's 15 now, I feel like we've seen a lot of stuff over the years and a lot of these miracle cures. And when we get back to basics, when we focus on detoxification, when we focus on nutrition, when we focus on targeted supplementation with giving the body appropriate, ways to manage all of what's going on, that's where the magic happens, right? It's not a magic pill. We're just really getting back to basics. And for children born today, getting back to basics means upping your detox game. There's no way around it. Yep. And parents, you have to be very savvy about what's out there, and, and question these companies and find the companies that have integrity. That's, a big piece for me, is I don't work with anybody without integrity. We have to take care of ourselves in all of this. And that's why I'm so passionate about the companies that I choose to support.
Yes, I can feel your passion. I'm exactly the same way. I vet every single supplement, food, diet plan, theory, whatever, a device, everything. I vet them all and make sure they are the best before I use them, first on my own family, myself, and my clients. So I'm with you there. And it's very exciting when you find one of those things that's just like, Yep, this can help a lot of people, not just like the one special one that needs this exact, like we all need to detoxify. This is the world we live in. We have to do it. I mean, our health depends on it. And so I love it. And so we actually almost did a study. I have to tell you, Terri, that we almost did a study with the, people with that were signed up on my newsletter, but I didn't end up getting it off the ground because I was just bogged down with other projects. But, this was something I've been thinking about for a very long time and watching its progression along the year, throughout the years, and really jumping in now to use them more, in my clinic and with my clients, and recommending it to people that I'm working with. So big time. And this is one of those things too that can send someone who knows a lot of stuff and been doing a lot of things like you did, and getting just really bloody close, and they're just like, okay, what is it that I'm missing? Why is this not working? Why are they not absorbing still? Why are they still having these symptoms? And so this is one of those things that can unlock all of those things. And so I just want to say too, that I want to clarify what you did when you were explaining what the IonCleanse actually does. Because, okay, and you mentioned on the cellular level, and I talk a lot about that, but I want to make sure that parents understand what that means. So you're saying that the IonCleanse, using the polarity, right, so positive or negative, it draws out from the cell these particular toxins, and then the body has the chance to excrete it. But we still have to make sure that the body's excreting. So if you're constipated, that's not good. You need the bowels moving. You need to support your kidneys, and also, so the excretion, routes, I guess, would be the kidney, the bowel, and the skin. Like you said, sometimes you'll find some coming out in the actually back itself. Is that right?
Guidance and support through your family's health journey.
Correct. You got it. And so I get asked a lot.
Please visit
what's this in the water? What am I detoxing? We don't really know.
Together,
at the end of the day, we don't really know. And Dr. Klinghardt, I was just presenting at Klinghardt Academy this past weekend, and he has done some studies on metals excretion. And what he found was after a single session, the IonCleanse technology by AMD, they found a spike in metals excretion 3 days after a single cleanse. Mm-hmm. So when we talk about, and I got questioned hard on, well, what's in the water and why haven't you guys tested the water? Well, first of all, I'm a little private practice here, and we are not funded by any big organization. So my passion isn't what's in the tub. I don't really care. My passion is what's going on in the human, right? Mm-hmm. And how can we maximize their overall wellness? That's my goal. And there have been people who've tried to measure the water in the tub, and there are a lot of variables. When you run a system with no feet in the water, you will get water change, because guess what? It's neutralizing the chemicals and the pollutants and the additives or whatever that are in the water supply too. But I can tell you, having just cleansed probably 200 people over in this last weekend, you'll have 5 people side by side. All 5 people can have very different buckets of water at the end of their cleanse. That's that individual excretionary detox reaction, right? What does it mean? I don't know. And I would never, ever think about, first of all, I don't diagnose anything, but I would never use a bucket of water to look and say, oh, you've got gallbladder problems. Absolutely not, Right. And so when you start getting out there, and that's where that scammy piece comes, because some of the other people who sell these foot baths are out there saying, oh, well, you're detoxing your liver and you're detoxing heavy metals. Can we piece together some symptomological things from person to person? I know what my normal cleanses look like. I know what my issues are, because I'm working on my own health and wellness in this journey too. Have I noticed correlations? Absolutely. Have I noticed correlations in the people that come into our clinic and cleanse? Absolutely. Even this weekend, it was like, you can say something and the person will say, yes. Oh, like, have you been exposed to mold? Yes. Mm-hmm. I just finished suing my landlord because they know our home, and I didn't know that. I'm not psychic, but you put together these patterns of, okay, is that diagnostic? Can I tell you what your mold values are by, it's not reading tea leaves, but it is exciting because the water does change colors, and one person does have foam and the other person doesn't. But in terms of what's going on, the real magic is that metabolic process. And like you said, the bowels have to be moving. The kidneys have to be flowing. Taking in adequate pure water, making sure your child or you are not constipated, getting out and exercising to the point of sweating, getting into a sauna. What this mechanism does is it really helps support at the cellular level. And it's not just what comes out in the tub, although I suspect we are getting that excretory effect because people feel better. Do you know how many people come with chronic pain? Or I've had people with colds and be completely stuffed up in their sinuses. Mid-session, they go, I can breathe through my nose now. I couldn't breathe through my nose when I walked in here. So there's definitely that immediate relief on the body. How it all works, I don't really know. I mean, and that's why I keep delving in and doing more research as our practice allows, because I do want to understand. But what I can tell you is methylation support was one of the first supports we started with our son 11, 12 years ago. And after doing IonCleanse by AMD for over a year, we've been able to stop doing methyl B12 shots for now 3 years. And I thought I was going to be doing methyl B12 shots forever because they were so impactful for my son. So in terms of methylation, I feel like it's helped. Can I prove that? Scientifically, no, other than looking at his labs and saying, well, here's pre-IonCleanse, and he was B12 deficient this whole time. And then here's post. And we certainly haven't, we've dialed into diet for a number of years. We've been dialed into supplements for a number of years. This is where we feel like we hit that plateau. And this is the only new intervention that we've brought on. My kids ask for it when they start to get sick. It's the first thing I do when I start to get sick. We feel like we get sick less often as a result of regular IonCleanse by AMD use. So these are those things where, if you're about optimizing overall health and wellness, detox has to play a role, but it has to be safe and effective. When we started delving into all of this, my business partner had another unit and it had a grounding strap. And I was really skeptical. So I wouldn't even really talk to her about that. We certainly didn't bring it into our practice at this time. She was just using it for her family. And then when we got into the first study and I started really getting educated on what is important when we're looking at technology? Well, first of all, you're mixing electricity and water. So that's the first red flag, right? But when you have to have a grounding strap, I don't care what they're calling it, if they're measuring blah, 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 that's a grounding strap. And that's so that you don't get, hurt by using that technology. That's not cool, right? And so knowing our children with autism, that whole unit could go in the water and the power supply is not in the unit. It's a separate independent power supply that's a medical grade power supply. When you start seeing some of these stories of some of these other cheaper units, this is one of those cases where you get to pay for. Same thing with supplements, right? We wouldn't walk down to, Walmart and buy our supplements and expect that it's going to be independently tested for heavy metals, that it's what it says on the label. These are those pieces. I am all about being cost effective. I'm a mom of a child recovered from autism, and for a number of years, we were a single income family. So I know all about ways to cut costs, but your supplements and your detox in regards to foot baths, that's not the place to scrimp, right? We can work on other places where we're going to budget, but those are some of those really important differences.
So with the the excretion, are you using binders? Do you find that helps with herxing, or does it help to actually pull everything out? Because it's not like most of the time the body should be able to flow and stuff, but you might need something to bind to. Do you use binders like zeolite, liquid zeolite, or advanced TRS, or things like that?
So some of my favorite products as binders are in the BioRay family. I love BioRay. They just really do a great job of formulation. And so if we're trying to stimulate detoxification, I like to use their NDF or NDF Plus, and it has the micronized chlorella, which helps with excretion of heavy metals and other toxins. If, however, we are working with a person who is having some of those Herx reactions, I like to give the NDF right after a cleanse. And that does help to go in and bind. Another one of my favorites is by Biocidin or Biobotanical Research, and it's their GI detox.
Yeah.
And so, or just, activated charcoal, right? The coconut husk. We did an interview with David Wolf, and he's a big fan of the charcoal and super charcoal and things like that. So absolutely, those binders can come in very handy if you're, when you look at like the Lyme population, there's a current Lyme study being done utilizing this technology. More of us practitioners are really saying, okay, well, we think it helps this, but we want to understand the mechanism of how, and we want to understand how fast can we help people feel better and detox. And so it's really exciting to hear of other doctors and practitioners that are engaged in this research. But you look at the Lyme community, that's a big Herx, category of people. Yeah. And I have heard anecdotally, especially if you Herx in HBOT. So HBOT, another great adjunct therapy, right? So oftentimes the recommendation is do an HBOT session and then get your feet in an IonCleanse. And again, you unburden the body. Working with a practitioner is great because you can then tailor your child's cleansing polarity shift, if you will, based on what they've got going on. Because if more of their issue is that negatively charged toxic load, like Lyme disease or parasites or glyphosate or whatever, you can tailor your cleansing polarity to adjust for that. And so then you would be giving the body more of those positive ions to be able to liberate and free up those negative toxins.
Cool. Wait, hey, so you're going to explain really quickly what HBOT is for parents who don't know what that is?
So that stands for hyperbaric oxygen therapy, and that is really exposing the body to concentrated oxygen. Many of these pathogens are anaerobic, meaning they do not live in an oxygenated environment. And so when we can force oxygen into the cells, we can really make big headway in killing off these pathogens. But as you can expect, when we're talking about flooding a body that might be, riddled with co-infections that are anaerobic, and now you're exposing the body to high concentrations of oxygen, that can result in, if we go back to that analogy of the crowded freeway, think about, a big football game getting out and trying to get on that freeway, right? That's what your body is going through. And it can manifest as like flu-like symptoms. It can manifest in headache, vomiting, diarrhea, body aches, joint pain and fatigue. I'm finding out, especially amongst my colleagues who do either ART, which is what Dr. Klinghardt teaches, that's autonomic response testing. It's a form of muscle testing. They are convinced that a lot of these co-infections reside in the joints. And so some of them are theorizing that that's why the IonCleanse is so effective, is because it really provides relief on the joints and the synovial fluid and things like that. And I have seen that personally in people who have a diagnosis of rheumatoid arthritis, maybe sparked by Lyme or other co-infections. And they usually report tremendous relief in joint pain and inflammation. They do IonCleanse even after a single session. So when you're forcing that oxygen into the cells, that can make it rather uncomfortable for our kiddos and for ourselves. Unfortunately, I've experienced that personally. Mm-hmm. And so bringing in another technology like IonCleanse or bringing in binders, right? It just helps the mop up. And then the body doesn't have so much that it's getting rid of. But again, at the end of the day, we go back to those basics: diet, making sure your detox pathways are open. And that means, I've had people who don't sweat. I used to not sweat. Yeah. And I didn't see any problem with that. I don't really like sweating. Honestly, but when you realize that's a really important piece of detox, there are kiddos and the parents will say, my child never sweats. We used to live in Phoenix, you talk about sweating, and they say, once we started doing the IonCleanse, my child will sit there during a cleanse and sweat. I actually had a person in the Clean Heart Academy this weekend say the same thing. Like, all of a sudden I'm starting to sweat. I said, oh, that's so great. What a good sign that those detox pathways are starting to open up in all ways. See, it's not just about what's in the water. You're going to sweat more effectively. You're going to excrete through your kidneys more effectively. You're going to excrete through your bowel more effectively. I mean, these are all theoreticals. I mean, I've studied the urine, so I know that. And people report that they sweat more effectively, or they sweat where they didn't sweat. That's great. When we can detox, that is amazing. You know, of all the stuff that we need in today's society, it's better nutrition and better detoxification.
Yeah.
So when you can use an intervention that's safe, relaxing, fun to do, you know, that's pretty amazing.
Yep. Okay, so one last question. It just, I was going to ask you for case studies and, you know, all this stuff, but I think that we should wrap up, and I don't want to, but so I'm going to ask you, what is, you know, maybe a favorite case study, or maybe even talk about your own son, like what got you so excited about that, and why this was a pivotal piece for you, using the IonCleanse Footbath by AMD, which is a major difference. What have you seen happen to, at least like one case study or your own son? You can choose.
I'll bring in a quick case study that I think is really impactful, especially in the autism community, and then I'll bring in a few pieces from my son. So one was an 18-year-old boy on the autism spectrum, limited verbal ability, very aggressive, okay? Mom had to homeschool him. She would work all day as a teacher, come home and homeschool him, okay? So you can imagine how challenging. Grandma watched him during the day. This was the only intervention. When we talk about moving somebody from sympathetic dominance into parasympathetic, he was verbally, he had the verbal ability to be able to tell mom, I feel calm when I do this. This was the only intervention, and we were able to reduce his aggressive behaviors dramatically. He was not destroying the house, not, you know, bashing in their TV, not coming after mom. You know, this is an 18-year-old child. He's big. He's bigger than mom.
Yeah.
You know, and so these are those pieces that are super important when families making the decision of what to spend their money on, right? So when we started, my son was 11, and I felt like he had plateaued, and he would respond to requests, but he wouldn't initiate. So, you know, when dealing with his siblings, if they asked him, you know, do you want to play this? Yes or no? Usually no, if I was honest. And when we started doing IonCleanse, after the very first cleanse, he was able to do this puzzle ball called a Perplexus when he had just gotten it for Christmas. And it was so complex for him. It's like a maze with a little BB, and you got to turn this ball like 360 degrees and get it through this maze to the end. He was like, no thanks. And so he'd given it to his little sister. He does his first cleanse. He gets up from the seat and he goes into her room, seeks this toy out, comes back, sits down. We're getting a cleanse ready for his sister, and he's doing this puzzle ball. And my husband and I are like, are we really seeing this? Like, you know, we're skeptical about everything. Like, are we really seeing something on the first, you know, duration? And so then later that day, we're in the car, and he asked his sister, hey, do you want to play I Spy? So again, that initiation, that more complex executive functioning, his fine motor improved, his biofilm, his oral biofilm resolved. He had, you know, more interaction with his peers. I mean, just all of those pieces, the social component, the fine motor component. At the time, I was homeschooling him. So I was able to see directly, wow, his fine motor is amazing right now. And how long have we worked, you know, with OT on trying to work on his fine motor? So some of those things were the really amazing things. We had another kiddo in the study who was 12. His mom was a speech therapist, and he was nonverbal. He started to speak in this study. There were other children who were starting to potty train. You know, when we talk about what do we want as parents in healing our children with chronic illness, we want those connection pieces. We want those self-care pieces. We want them to be able to move confidently in this world. And so for me, that was what won me over. Like, you know, like I had to bring it into my home and try it myself. But at the end of the day, I wish we had started this intervention on day one, because I feel like it made everything else more effective. All of the supplements we've been trying to push into him probably weren't getting absorbed at the rate that they are now. And now, I'm going to be honest with you, he's on a probiotic, and he's on a multivitamin. And that's it. And he's 15 and he's doing just amazing. And, so for parents out there, my biggest thing is sharing hope. We are facing a children's health crisis.
Yeah.
And unfortunately, it's up to us, right? It's up to us. A lot of us have become practitioners because of this. We are going to mobilize and we're going to change the future for ourselves and for our children. And so understanding what's out there, really understanding the science on what can helpful is really important. So I applaud you for doing the summit because these events are critical for parents to be educated.
Thank you, Terri. Thank you. And I applaud you for doing what you're doing for so many people, not only your children, your own family, but everybody else in your path. So thank you as well. And I can't think of a better place to end this interview than what you just said. So thanks so much for being part of the Children's Health Summit 4, Dr. Hirning. And we will be linking to a link so people can check out the IonCleanse Footbath by AMD, and also your website if they want to find you, more information from you, where your clinic is, and all that kind of stuff will be under the talk. So thanks again, and have yourself an amazing day.
Thank you. You too, Carla.
I hope you enjoyed this interview, and be sure to listen to more interviews from this timely and groundbreaking series. If you would like more information, guidance, and support through your family's health journey, and or want to join our growing community of professionally trained family health coaches, please visit us at healthyfamilyformula.com. Together, we can turn the tide for the future health of our children. May you and your families be well.